Good morning.
We're gonna go ahead and get started.
I'm Jacqueline Wilson again. I am one of the alumni of the Forensic Science Program. And yes, I am honored this morning with Dr. Marissa St. Martin. Dr. St. Martin is a board certified pathologist, anatomic, clinical pathology, and transfusion medicine. She is currently the medical director for One Blood in Jacksonville, Florida, and holds an academic affiliate appointment with Loyola University. Dr. St. Martin is also a certified life, career, and executive coach with ample experience in subjects of resilience, burnout, and wellness. In this role, she chaired hospitals, multidisciplinary wellness committees, developed and established an accreditation council for graduate medical education, complaint wellness curriculum for the Loyola residency program, and provided coaching services for several individuals. She is also a certified meditation and mindfulness teacher. In 2018, she won the prestigious Rogers Sankey Award from the American Association for Physician Leadership, and she became the Medical Education 2019 Robert T. Wong Leadership Award recipient from the University of Hawaii Medical School, John E. Burns School of Medicine. Welcome.
Thank you so much. All right.
Yeah.
Is this all right?
Yep.
Okay. Thank you all for having me. Thank you for inviting me to speak with all of you. I am not coming from the forensic world, but I had to tell you that forensics was in my realm of choosing specialties. I come from internal medicine and then went into pathology. So blood banking gave me a little bit of that medium in which you still see patients, in apheresis, for example, and still do a little bit of the scientific world that we all do in pathology. So I started being more interested in all this burnout and resilience issues, going through my own burnout. And I have burnout several times in my career, as I am sure you can go back in your careers, even as a medical student, or whatever you did before that you felt all that stress that you cannot cope with. I just didn't call it burnout. And, these days we are almost getting burnout of the word burnout, because you see articles, you see, news organizations talking about it, everybody. So I'm going to talk a little bit about burnout, but I mostly want to focus on different things that we can do to actually prevent it and increase our resiliency. So these are the objectives that I put here for today. So take a look at them. We're going to define burnout, know what it is a little bit, identify the differences between stress and burnout, and then learn those strategies. So those are my objectives. I want you to think about your objectives now. So take just a minute, look at this, and set a goal for this meeting. Dr. Daniel Freeman said one time, and that stuck with me, is people basically take more of what they create. So if we create this conversation together, when you walk out that door today, you're going to be bringing more of you, more of this conversation to your life, and you'll be able to implement more things with, in your career and the rest of your life, hopefully. So set a goal for this meeting just for you. Maybe you want to learn one tactic about what to do, tomorrow about your own stress or burnout. Envision that success. Think about walking out of here with a lot of knowledge or a lot of insight or a lot of maybe just relaxation after this. And then think about what can it get in your goals. And then maybe try to avoid that. Sometimes we get distracted. I know that we all have our phones. We get called all the time, but try to give yourself a little bit of time, to take advantage of whatever you're learning in this whole conference. See what tomorrow when the conference finish, how do I want to go home, and what do I want to take with me from these days that I spend here. I mean, you spend the time to come here to drive or fly, and it's important that you take something out of it, right? So this is Dr. Christina Maslach, and you may have seen her picture. She's pretty famous. She created the Maslach Burnout Inventory, or MBI, which is, and that was in the 1970s with these two other psychologists. The burnout inventory is basically a test to test burnout in the workforce, not just in medicine, but in all the workforce. And now, even today, after 1970 until today, we still use variations of the MBI. You can do the whole MBI, which is a long test. There is an abbreviated version with only 22 questions, and basically measures burnout in the workforce. Not only she gave us this test, but she also let us understand a little bit of what burnout is. And she gave us the three main symptoms, and those are exhaustion. And when she talks about exhaustion, she talks about a more, not just I'm physically tired and I need to take a nap and I'm refreshed and now I can come back. She talked a lot about an emotional exhaustion, that even though you may go on a vacation and come back, the minute you step back at work, you're like, oh, I'm already drained from everything that I had to do this day. She also talked about depersonalization, and depersonalization is basically becoming a little bit more callous about the work we do every day. What does that mean? The next case, instead of being a family member, someone that we are trying to, study to give answers to the public, to the families that are waiting for those answers, they become an obstacle for us to get home earlier. So we forget, in a way, why we came into this profession in the first time. And then she also talked about a lack of personal accomplishment. And that's when people start feeling like a cog in a wheel, and you are not really here having a purpose. You are here basically just to do, something more, and you're not important. You forget what your purpose in this role is. So stress is part of normal life, right? Stress actually could be a good thing. Sometimes when we have a deadline, a test, some report to turn in, it puts a lot of fire under us and we get it done. So stress is not always bad. When stress becomes chronic stress, though, it can turn into burnout. Burnout is a little bit different. Burnout is the consequence of lost ability to recover from the energy drain from the things that stress us out every day. And I put this table because I love it. I think people talk about stress and burnout interchangeably, and they're not the same. And here you can see that when someone is burnout, and the end stage of burnout is disengagement. So the person does not care anymore. Disengagement means that even if someone is, upset about something, they don't even care about doing something about it. They are completely detached and removed from the situation. Stress is just the opposite. It's overreactive emotions. The overreactive emotions will make a person scream, yell, slam a door, even cry, but there are still emotions there. When people are burned out, they're already done with all of that. It's like they pass that point and they are like thinking, no one cares about me. I don't care about anything. I'm done, and I am, completely burned out. So it's a very, very, in a way, dangerous situation, because the person is forgetting again why they're here in the first place. This integration with stress, because stress could be very disruptive, right? In a meeting, if someone is stressed out, they are, being aggressive, being not really collaborating with the team, etc. Demoralization and burnout, because the person doesn't even give their ideas anymore. There is a sense of helplessness and hopelessness with burnout, and there is a sense of urgency and hyperactivity with stress. When we are really stressed out, we want something to change now because it's annoying us to the point that we cannot take it anymore. That's stress. Burnout is that we are past all of that and we are becoming more disengaged every minute. So this is just a Medscape, report in which they put healthcare burnout. I was asking some of my friends that are forensic pathologists, what is the thing that burns for forensic pathologists the most? And she said the workload, the caseload. And that's number one for our pathology. I'm the co-chair for the wellness project team for the CAP, and we did a survey and workload came at the top. And sometimes we have no control over that workload because it's not that we can say, well, I don't want this many autopsies or I don't want this many slides to review. They come to us and we have to do them. So workload is one of the number one issues for all healthcare workers, not having control. So being bossed around by management means basically loss of autonomy, loss of control of what we do every day. The bureaucracy that we had to deal every day with, long hours, regulatory issues, income reimbursement issues, the EMR, mergers, acquisitions, patient overload, the patient suffering. Maybe I'll make a point about patient suffering. We try to put this barrier, right? When we see these people and we're doing an autopsy, but that does not mean that we are not intimately affected by that suffering that that person had. And even though we put our hat of scientists and we try to do this in a very unemotional way, a psychologist that I met at one of the CAP meetings, she said, trying not to be affected by patient and human suffering is the same as trying to walk into water and pretend to come out dry. So we are affected and we shouldn't minimize that effect when we are talking about burnout and our role in all of that. So this is pathologist burnout isolation. We are removed from patient care. We don't get, like many other physicians may get, from the patient or the patient family. Thank you, doctor. You saved my mother's life. Thank you for this. Thank you for that. We very seldom get this kind of recognition for all the work that we do, the wonderful work that we do. Again, no control over workload. Turnaround time pressure. I'm sure that you feel that every time, right? And when Dr. Simpson was saying, where's the toxicology report? And, you sent it 2 hours ago, how come it's not here already? Pressure for detailed, accurate reports that goes back to communication. It's the way we send those reports and how accurate they are and how clear they are that we're going to have maybe more questions about it and make our days longer. Lack of recognition by other healthcare providers, maybe patients and families. And then we have a very regulated system like everyone these days. So this is one of the CAP surveys that we send. And you can see that this is pathologist-specific data. With it, we only had like about 1,200 respondents. And with the highest reported burnout rates were in the first year of residency and then in the first 3 years of practice. Now, we really don't know yet if it is because people get used to things or because they become more resilient and they, start feeling a little bit better about what they do and they know how to cope better. In the wellness project team survey, we also have about 40, these results that said that 41% of CAP members reported having at least one symptom of burnout. You know that in 2014, there was a seminar article from Dr. Tite Schoenfeld that reported that 54% of physicians in this country were having burnout. Now, when he talks about it, he's saying the physicians are reporting one or more symptoms of burnout. I can guarantee you that if 54% of doctors in this country have burnout, we would not be able to produce medicine or practice medicine the way we do. We all have doctors, we all have our patients too. So if you have 2 doctors, that would be basically 1 in 2 doctors that are having burnout. So it's not complete burnout, but everybody may have one or more symptoms. the rest of it, you can see it there. We have this paper coming out, so hopefully you'll be able to read more of the details. What are the consequences of burnout? I always say when we are not well, we cannot bring wellness to others. And that means our families, ourselves, our team, and anybody that works with us. So the consequences are increased error rates with increased risk to patients, deteriorated colleague relationships, increased job turnover, and absenteeism. And with absenteeism always comes presenteeism. So you have people that have to be there because someone else is calling in sick, and the person that is there is getting all the load of the person that calling sick or didn't show up for work. That creates additional shortages, higher litigation risk because of the medical errors, increased health problems, personal health problems, increased overall cost, and job dissatisfaction. This is from the National Academy of Medicine. People started paying attention when they saw how much is the cost attributable to burnout in the United States each year, 4.6 billion. So then suddenly everybody's talking about burnout, and every hospital that you work with may have a wellness committee or a wellness initiative or something going on. So, you can see how all of this is integrated and why, we can see the cost increasing with burnout. I did a very random and actually casual survey during COVID-19. And of course, I work in transfusion medicine. We have about 37 apheresis nurses that work with us. And a lot of the data comes from that. But these are the things that we're adding to stress during COVID. Fear of our own exposure when we are, dealing with patients that, have the disease. Fear of transmitting the virus to the family. Fear of staff shortages, not having enough PPE. Those were the top, answers that I got. And then small teams. When you have a small team in a hospital that is working for 3-4 people and 1% had COVID, then you know that the other ones maybe got exposed. Who does the work? Who helps, the patients? That's the cases that we need to do. Feeling not being prepared, the uncertainty, delays in providing medical procedures. And it goes on, and this is more really blood banker specific, but we did go into a lot of maybe stress, I don't know if burnout, but it was contributing to burnout, about the unpredictability of the blood supply. At the very beginning, when we didn't have vaccines and we didn't have anything and we didn't know what was happening in the world, CCP or COVID convalescent plasma became one of the maybe life-saving things that we had to help patients, but we didn't have any. Everybody was having acute COVID symptoms. So the FDA put a rule saying that you cannot take anybody that has active COVID up to 28 days. Then they decreased that to 14 days. But at the beginning, we had hospitals, patients, family members calling us desperately and saying, can you give me the convalescent plasma for my family member? They are dying. They cannot breathe. And blood bankers had to answer those phone calls and say, we don't have it. We don't have it. And we started to make, in a way, a little bit of negotiation with the hospitals because they were the ones diagnosing COVID disease. So we told them, okay, you want CCP, we'll send you a unit, but you have to send us a donor. And that's how everything started until we were able to accumulate enough CCP to be able to have actually blood banking capabilities. And like now people order red cells, we send them red cells, right? And then we match the type specific, etc. But with CCP, we didn't have any. So we had to get one donor and send one unit, which we didn't even know if it was the same blood type, but we were not able to ban CCP until later. So that created a lot of stress in my field. This is also a poster from the National Academy of Medicine, and there you have a lot of information, but I want you to see that physicians are basically 2 times more at risk, for burnout and depression than other people. Particularly female physicians are at definitely more risk, but you can see that nurses are also at risk. Technologists in the laboratory are also at risk. If you are more interested, this is a QR code for the CAP Wellness Resource, and there is a lot of information there. You are going to see posters, you're going to see articles, you're going to see some or hear some podcasts, and we are trying to increase the number of people that maybe pathologists particularly that suffer from burnout to tell their story, because sometimes when we tell the story, we are telling someone else, hey, you're not alone, and that's one of the things that happens with burnout, and that's one of the things that happens with physicians, the isolation. We don't want to be the ones feeling the weakling in a team, so we don't share this information with anybody else. We keep it to ourselves, and that's the worst thing we can do. And then we go home, and maybe our spouse or significant other is trying to, cheer us up, and we shut them out, and we basically isolate from the people that actually can give us the most support. It's a vicious cycle. And unfortunately, since 2018, we got our own Physician Suicide Awareness Day. That is in September, and we were given basically, this is for all suicide risk, of course, not just for physicians, but there used to be a 1-800 number that was very long. Now they changed it luckily to 988. And if you don't have it, remember it, it's like 911, but remember the 8, if we twist it, it's like the infinite sign. So maybe you remember if someone that you feel like is near to you having, you see that they are depressed, that they are disengaged, that they are not talking to anybody, not only ask them, are you okay? I'm here for you. Do you want to talk? But also have this ready in case you need it. You don't want to be Googling things, when someone needs this kind of number. All right. So stress is something that arises when something you care is at stake. We remember that our brain perceives threats and we react, right? With sensations, with thoughts, with feelings, with behaviors. And the perception of stress is as harmful as real stress. I live in Chicago most of my life, but I live in Florida now. And sometimes I've seen enough snakes. So sometimes I am walking and I see something and I'm like, is that a snake? And my heart starts beating fast. And then, it's just like a rope or, something, a leaf or something that maybe looks like snake. But the perception of a snake, yes, it will make my heart beat as fast as if that was a real snake. Our bodies respond to stress. It doesn't matter what's happening. If you come to the office and you feel like your boss or someone is going to tell you something bad, you're already stressed. You're already perceiving all of that. One of the ways to kind of involve a little bit the rational brain, the frontal cortex, is to try to, of course, pause and breathe and name the feeling that you're having. Is it fear? Is it anger? Is it, whatever it is, there is a negative feeling, name it. And when we are naming it, we're already involving the frontal cortex. And by that, we are involving our creative brain. And then we have better answers, better ways of responding to that stress. Okay. Burnout, we cover a little bit. So let's talk a little bit about resilience. And this is just the 2 first bullets are definitions from the dictionary. What is resilience? Is the capacity to recover quickly from difficulties, is the ability of a substance or object to spring back in shape, basically to bounce back, right? Now, what is not resilience is making you stronger so you can withstand anything and you keep going, even when it isn't good or right for you. So it's not about how you endure a situation, but it's about how you recharge and make it a little better for yourself. That being said, I am a true believer of a multidisciplinary or multidimensional way of approaching this inspiration or cultivation of resiliency. We cannot do all of this by ourselves. When someone is stressed out or burned out, if you tell them you need to sleep better, you need to eat right, you need to, take time for yourself, all of that is putting it on the person that is burned out. So they are probably feeling like, not only I'm burned out, but now I have this list of things to do, to get myself better. It's all on me and I'm guilty of it. So I agree that we all have a responsibility on our own wellness, but there are other things that can be done. And those things have to come from the organization that you're working and from the group. And we'll talk a little bit about each one of those. Did I move this? Yes, I did. Okay, so let's talk first about the organization or institution you work for. The first thing to look at is your mission statement. And your mission statement could be triple aim or quadruple aim, and we'll talk about the difference between the two. Your leadership. Is your leadership aligning with having a workforce that is actually well and able to do the job that they are supposed to do? And the core values. And that happened to me when I feel that core values of my institution are not aligning with my personal values. It's time for me to move on. Because maybe I cannot change a whole institution, but I have to be in a place in which what I believe is what the institution believes. And then I become not just a happy employee of that institution, but I become an engaged employee because we're all fighting for the same thing. So you may know this from management lectures or whatever, but in the 1990s, we have the triple aim of healthcare, which talk about population health, the experience of care for the patients, and per capita cost. So we all wanted to be good stewards of the resources that we have. It was not until the 2000s that we came up with the quadruple aim, because what was happening in the triple aim, or what was missing in the triple aim, was the provider wellness, the provider, experience. So here you have in the quadruple aim, provider experience. How happy are people to work where they work? Do they have a good balance in their work life and everything else that happens to them? Can they work on workflow optimization? So if your institution has a mission statement, take a look at it and maybe see if they mention the staff at all or not. If they mention the staff, you can go to the administration and say, hey, we have a quadruple aim of healthcare, and it says here that you really want to work for the healthcare of the, for the wellness of healthcare workers. How come we're not doing this? Are there any initiatives? So you can go and kind of claim that a little bit. If the mission statement is a triple aim, then you say, this was in the 90s, now we are in the 2000s. Can we move into a quadruple aim mission statement in which the wellness of the healthcare workers is important to the organization? So there are ways of making the administration do a little bit better for the people that work for them. This is again from the National Academy of Science that has, or the National Academy of Medicine, sorry, that has a lot of information on clinician, physician well-being. And here you can see that everything is in a way connected, right? There are outcomes, and the outcomes between, everything that you see on the left there, the work system and the individual factors could lead into clinician burnout or physician burnout and professional well-being. And then the consequences are affecting everybody, are affecting the patients, the clinicians, healthcare organizations, and the society in general. Again, we are all patients. We're not only we work in what we work, but we also need our own doctors to be well. And then learning and improvement, and it's all connected. Now, I wanted to mention some legislation efforts, because I always want to give credit to the states that started with this first. So Indiana, South Dakota, and Virginia did the very first healthcare worker wellness legislature, and as a state, they wanted to treat their physicians well and basically make them feel better about what they do every day. In 2020, of course, with COVID, we were all called heroes at some point or another. And we came up with the Coronavirus Healthcare Workers Wellness Act, which brought a lot of awareness in Congress about how physicians were getting burned out, especially during the COVID time. And then in February 21 of 2022, the Dr. Lorna Bream Healthcare Provider Protection Act came about, and it talked even more, and it provided some grants for wellness for the different hospitals and institutions. If you don't know her story, I invite you to Google her name and see what happened with her. Lorna Bream. All right, the group. So we talk about institution and even, state level and national level initiatives that can happen. What is the group? The group is the people that work with you every day. So even though the organization may have a wellness committee or wellness something, or maybe a wellness room, whatever they can provide, your group is the people that you see every day, every morning. So it may be not all physicians, maybe like many of you. Right now, I'm the only physician where I'm working. So I have, my techs that I work with, my nurses that I work with. So those are my group. And the group itself has very individualized needs that are different from the whole institution. So the group is important because you can do things that are helping that particular need instead of the institutional need. The core values of that group will be also defined by the people that are participants. And I want to say this, any group can do this. Start where you are with what you have. I'll show you a little example. So that's my dog, Jack, the lab, and then the other two are my daughter's dogs, the winter dogs. And you can see Jack is 11, rescue. The Ollie on this side is, I think he's 13 now. I'm not even sure, another rescue. And then there is Richter, who is the baby. And I had to tell you, they are all different kinds of dogs, different sizes, different backgrounds, different color, different ages, different everything. When they want something, either a treat or to go out for a walk, they all get together and they form a team and they put that cute faces that you can't resist. So what I'm saying with this silly picture is, as a group, if you have one mission, you can do whatever that group wants to do. You can make it happen. So make sure that you look at what are your initiatives, what are your core values within your group, with your techs, with the people that you work with every day, with the person that answers the phone every day. And any group can do this. C and C is for competency and compassion. When I give lectures in or talks in leadership, one of the questions that I get asked a lot is like, okay, but people want time for this and time for that, and who does the work? Someone needs to do the work. Any group needs both. And this came from Jocko Willink. I didn't come up with this, but he said competency and compassion. Competency means having a schedule, having the work done, making sure that the work is covered. Compassion is, hey, someone's relative passed away, can someone cover for that person? Someone is going on maternity leave, what are we gonna do about it? So we need both. You cannot go all compassion because then the work doesn't get done. And then we are not being compassionate to the families that are waiting for answers from us, right? But it can not also be competency and forget, the needs of the people that do the work. This is a study that I put together. This is from Loyola. I was the associate program director for the residency program in pathology at Loyola. And in one of the meetings, I saw that the residents were not very happy. So I took sticky notes, and gave them each of the residents one. And I said, mention in those sticky notes 3 positive things about this department or institution, 3 things that are frustrating you, and 3 things that you would like to change. And you're not going to give them to me. You're going to give them to our administrative assistant. I'm not going to see who wrote anything in case you're afraid that your handwriting will be matched. There was a lot of fear of retaliation. So I said, this is completely anonymous. Say whatever you want to say. Give it to her. She's going to type it and I'm going to get the data, nothing else. And with that, we started to see a lot of things that they wanted to do, a lot of frustrations that were there. So I went and I talked to the chair and I'm like, I want to start a wellness curriculum and a wellness, we call it the wellness club. We would meet once a month. We'll meet for lunch, which was provided by the chair, which was a plus, right? And then from that data, what I did is I put all the positives together and I read it to the group. And in reading the positives, it was a very encouraging experience because people thought, yeah, we have a really great pharmacy here. They always help us with whatever we need. Or yes, our admin is fantastic. Or yeah, a lot of positive things. Some people were saying, I didn't think of this, but yeah, it's true. Dr. So-and-so is wonderful with all of us. Or the lectures that we get at whatever are so good. So it started in a positive way. And then we went into the frustrating things. And then we went into the things that they wanted to change. And I asked them to rank them. What are the things that you want to change first? And then we'll move forward. And you will be surprised what they told me. They wanted a coffee machine in the residence room, and they wanted the carpets in the residence room to be clean or replaced. Because they said residents from other, special discounts to look at slides, and it's an embarrassment. Simple, right? Very, very simple. I went to the chair. The chair said, no problem, done. And then more things started to come up. Why? Because they felt like, oh, someone is listening. So maybe I could say that we also need, better camera to take pictures for when I present a tumor board. And I can say, more things started to come out. So then we did a survey, like a more formal survey about, different things that were before and after the wellness curriculum. I came up with, we put all the 6 competencies that ACGME, requires. And then I asked them, before and 1 year after, my opinion counts, knowledge about burnout, do I have personal resources, knowledge, group resources, institutional, did I see a coach, contacted the EAP, etc., etc. You can read there by yourselves. But the before is the red, the orange is the after. Simple, done, and it was like a complete success. In the end, what do we all want at work? We want to be recognized. We want to be able to grow in the careers that we choose. And we want to be able to have the materials that we need to do our work. And that's why the absence of PPE was so, crucial for everybody. And we also want to be thanked. And if you are the boss, remember to thank the people that are with you. And when you say thank you, don't just say, oh, thank you. Say, thank you for this day that you took this case for me, even a colleague, right? You took this case for me. I was able to go and get my daughter to that recital that she needed to go. Be specific, because when you're saying thank you, not only you feel gratitude, which makes you feel rich and lucky that you work with such nice people, but also gives that other person that recognition for doing something nice. So if burnout is exhaustion, disconnection, and a decreased sense of accomplishment, how do we best navigate stress and re-engage the experience to create more health and vitality, fully connected relationships, and thrive with significance? We're going to start talking about our individual responsibility on our own wellness. And this is from Henry Nouwen. If you haven't read anything about him, I also recommend his books. Joy does not simply happen to us. We have to choose joy and keep choosing it every day. And that is so true. We always, joy is internal, right? If we win the lotto, we're going to be happy until everybody starts claiming like, you should give me this, you should give me that, the taxes, the this, the that, things change. But joy is internal. We'll bring it with us to whatever we do. This is a graph that has some of the individual strategies that I am sure you all have heard and know. But knowing is not enough. Knowing that I should avoid repetitive thoughts, that I should make time, to be with others, that I should eat healthy foods, that I should exercise and sleep well and all of that, of course, go to my doctor when I need to. All of that we know, but knowing is not enough. Knowing is only half of the equation. We need to create habit. Make sure that you are doing the things that you know you should do. And do you all have your cell phones with you? If you do, I'm gonna ask you to pull them out. And well, let's focus on the second tile here. Make time for friends and family, or make time for yourself. I would like you to put in your phone a date with someone. So schedule it and put it on your work schedule. So it's important. It's part of what you do every day. I don't know if anybody can read your work schedule. If not, just put a code, thing for you. But if you put it in your schedule, you're going to do it, because that's what we do, right? We're always tied to what we need to do next, what meeting to attend next. So make a date with someone. And if there is no one, make a date with yourself. Schedule a massage, a golf lesson, nail care thing, whatever it is that you want. And when that day comes, if there is an emergency at work and someone says, can you cover me, please? Someone needs me. And you said, okay, but then you're going to look at your schedule and you're like, oh, wait a minute. So if covering that person is very important, you're going to call your date and say, hey, I cannot make it today, but I will reschedule and make it for next time. Make that time important as what we do at work. I don't like this phrase work-life balance, because I feel like work is also life, right? It's not about work or life. We are living when we are at work. So let's make an integration of everything. Let's make life balance, not separate the two. Other things that, people mention having like more happiness and more happiness, joy, and feeling part of a community is when we help others and volunteer. So if we have time, right, we can do a little bit for others, and that gives us a reward. Of course, I'm a blood banker. I'm gonna ask all of you to, if you can donate blood, please go donate blood. It will make you feel good. You will be saving lives, up to 4 lives. Remember, we can separate those blood components so they can go to 4 different people. So a little, how do you call it? Shameless plug. Yes. And of course, connecting with your spirituality and purpose. And because I am a mindfulness teacher, I had to talk a little bit about mindfulness and meditation. So here's Jack again. You can see that here he's meditating. You see his eyes closed. And then a few minutes later, he's there super alert, right? To be ready to go for that walk in the woods. So mindfulness meditation, everybody's talking also about mindfulness. All magazines, even on the plane, there was something about mindfulness. It's also a buzzword. all it means, mindfulness is to be here now, to be in the present moment. We are all tied up to predominantly anxieties of the future. I have to do this and I have to do that, and the meeting is next, and blah, blah, blah. And we are there, or regrets of the past. I should have said that, I should have studied more, I should have, whatever. And or we are there and we are never in the present moment. And that's all we have, this moment. So if you are every day, every time, every second in your present moment, when you look back, you will feel like you actually lived your life fully. So that's mindfulness. And this is from Ellen Molly. She said, almost everything will work again if you unplug it for a few minutes. I'm sure you have done that with your computer, your phone, and that includes you. Think of your brain as a computer. So I'm going to teach you a 30-second mindfulness technique, and I hope you humor me for this few minutes, and I'm going to be explaining this, and then the 30-second practice. It gets people get a little anxious when they start talking about this. But if you don't like it, you never have to do it again. If you like it, please do it as often as you wish. It's called the squeegee breath, and this was taught to me by Dr. Dyke Drummond when I did a burnout retreat for physicians. It's called the squeegee breath because we're going to be thinking of a window that is full of soap, maybe a car wash, or maybe a window, in a building, they're cleaning it, full of soap. That's our mind when we have so many thoughts that are going back and forth and dripping and this and that. Sometimes those thoughts even wake us up at night, right? You're sleeping and suddenly your head is, full of things that you're thinking. When we take that squeegee down for the first time, there is such a clarity that now we can see clearly. Instead of seeing that foggy shape or maybe some light, we now can see clearly. So that's the idea about the squeegee breath. And that's the idea about calming down our thoughts a little bit. I always represented this, and I know I told my therapist this, I feel like it's a ping pong table with 1,000 little balls going because I cannot really get it, to stop. So how do we stop it even for 30 seconds? With this. So the squeegee breath has 4 components. We're gonna set an intention. We're gonna take an inhale. We're gonna take an exhale, and then we're gonna smile at the end. And that's it, super simple. So humor me for 30 seconds. Sit straight in your chairs with a straight spine and your feet planted on the floor. And let's set the intention of being here now. And if you're comfortable, close your eyes. If not, you can focus your gaze a little ahead of your feet. And with that intention of being here now, let's take a deep inhale to the top of our heads. And exhale. And as we exhale, let go of everything that doesn't belong to this present moment. We can open our eyes and we smile for muscle memory, triggering brain memory. Psychologists have what is called laughter therapy. And laughter therapy consists of one person saying ha, the next person says ha, and then you have full auditoriums, thousands of people going ha 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 ha, and then suddenly everybody's hysterically laughing about laughter. Nothing more than that. I hope you were able to observe maybe the quiet when we do this exercise. It helped me a lot when I was very, stressed about different things. So I needed to create habit. Remember what we said before, knowing about it is not enough. So I will put sticky notes on my computer. I had one in my phone. So when someone called me, I will take a quick squeegee breath. It doesn't have to be so dramatic, right? You can take a breath and just let it go. But I would set the intention of being present for that person. My mom is visiting me from Argentina. It's been with me for now 5 weeks, and I have 3 more weeks to go. So when I go into the kitchen, I take a squeegee breath to decide what kind of daughter I want to be, right? It's like that's my intention. I want to be good to my mom. She's old, and I try when I go home and the garage is opening, my intention is to leave work behind and then become, the dog owner, or the spouse that I want to be. So if it helps you, put sticky notes, put reminders on your phone. There are wonderful apps, that talk about mindfulness and, reminders for mindfulness that can help you with this. It helped me deal with stress tremendously. Like I said, I started getting interested in this when I had my own burnout. I want to be mindful of time. With my own burnout, and I wanted to make sure that I was a better person. Remember, we cannot give what we don't possess. So if we are not well, we are not going to be able to help anybody. And that's so true. When you see someone that is hurting, I don't know who said this, but hurt people hurt is so true. When people are not well, they cannot give any wellness to anybody else. Mindfulness gives you time. Time gives you choices. Choices skillfully made lead to freedom. I'm gonna skip this part because I want to come to this. We talk a little bit about connecting with others and practicing gratitude. I think Dennis Prager is the one that says gratitude is the first step to happiness. When we are grateful, we feel rich. Instead of being, we feel immediate richness in our lives instead of focusing on what we don't have. Mindfulness also gives you that calmness and gives you that choice. Now, remember from being called a hero as a healthcare worker, just remove the H for human and remember this little formula. E is for event. Events could happen. COVID happened, right? I live in Florida now. Hurricanes can happen anytime. There is nothing I can do to stop it. There was nothing we could do to stop COVID from coming and infecting the number of people that are infected. R is for response. Our response can change, okay? Our response to the event can change. If there is a hurricane coming and I just sit there and do nothing, my outcome is going to be one way. Maybe the way I want it, but it may be one way. If I prepare, if I evacuate, if I need to evacuate, if I do the things that I need to do, the outcome is going to be different. So never feel powerless. Remember that outcomes can always change. Even if the event is unmovable, your response to that event will change the outcome. All right, and this is about connectivity and protecting others, more about connectivity. Remember, we are human creatures. We need each other. Even if you're isolated, make sure that you connect with others via Zoom, via phone call. Schedule it for you, in your work schedule. So it's important. And many of us flew here. So the airplane reminds us all the time. Put your mask first before helping others. Even your child, your most precious creation. You are supposed to be well and breathing in order to put the mask on that other person. All right. And I think that's my last one. Be here now. And I always like to finish with this question that you don't have to answer. It's for you, but it's what have you done to bring joy to someone's life today? And you may say, hey, I've been here since this morning. I didn't have the time. Think about when is my next opportunity to bring some joy to someone today. Some of my really unreadable, right? References, because I've been doing this for a long time, but there's my email if you ever need anything, if you need to talk, if you need ideas, I'm available, and I'm sure that Dr. Miller can reach out to me if anybody needs any kind of help. Thank you. Any questions, comments?
Couple of questions.
question, but more like a comment.
Yeah.
I know that a lot of people have been through COVID, and that has brought the awareness of mental health more out. And I'm glad we're having that conversation about burnout and stress, because often we press through things in life and, you know, it just packs down. And if we don't have that mindfulness to just ask for help or encourage or do some of these exercises, it's with the line of work that you guys do, and what you do, what you see on a daily basis it's really helpful.
Yeah. Yeah, I remember that when you, thank you for that comment, because it's very good. When you ask for help, not only you're admitting your vulnerability, like, hey, I'm not invincible here, I also need help, but you're also giving that person that you're asking permission to ask for help when they need it. So that forges community and forges, you know, that it makes stronger that bond that you have with that person.
How many of you have trouble falling asleep because your brain won't shut down? Right, so a really good, quick mindfulness technique. The squidgy breath is not usually helpful for that. It's good for exactly what you said, but a good way to fall asleep is called body breathing. So you close your eyes and you breathe into each part of your body, into your head 3 times. Imagine the air going into your head, filling it, and then exhale, imagine it going out 3 times. 3 times in each arm, 3 times into your chest, 3 times into your belly, 3 times into each leg. And guess what? You'll get sleep. It works every time. I've been doing it for 6 years. It's
That's
a
awesome.
mindfulness book, and you don't know anything. You just fall asleep. It's really amazing. And there's
Yeah.
a couple of other techniques that are like that. All these books have these sort of things, but you don't need to have 100 of these techniques. You just need like a squeegee moment and a way to fall asleep, and your day, the next day will be incredibly better. So I encourage you to find your own techniques to do that. Thank you, Melissa. for sharing.
Yeah, thank you. You know, I just want, I know we're on time. One more second, but I know that, you know, mindfulness, not everybody is up to doing meditation. Meditation is a way to mindfulness. Meditation is just basically one way, but no one size fits all, right? You get people like to go for a run and be mindful about that run, and, you know, make sure that you're concentrating on what you do, and that's fine. Other people like to paint. Other people like to do puzzle works. And the idea is to keep your mind relaxed and focus on something that brings you to that present moment. That's all that is. So again, you can find your own way and see which one works for you, which one is easy, which one you can do often, and then make notes of how you were feeling before, how you were feeling after. And then if it doesn't work, try a different one. Prayer is a way of meditation, and it's a way of, you know, also keeping your mind in what you do. So, you know, many ways of getting there.
Right, thank you guys so much. We're going
Thank
to take
you.
a break.